more tools of the titration trade with a focus on anamoxetine, ziprasidone, and quetiapine. Welcome to the Carlat Psychiatry podcast, keeping psychiatry honest since 2003.
I'm Chris Aiken, the editor-in-chief of the Carlat Psychiatry Report.
And I'm Kellie Newsome, a psychiatric NP and a dedicated reader of every issue. Today, we cover two medications where rapid titration can cause a dangerous inflammatory reaction: Clozapine and lamotrigine. We follow it with a research update on propranolol in panic disorder.
Textbooks have always recommended a slow titration with Clozapine, starting at 12.5 or 25 milligrams a day in divided doses and raising by increments of 25 to 50 milligrams. That wisdom is still true, but we now have a better understanding of why. We used to think it was to prevent low blood pressure on the drug. We now know that slow titration of Clozapine also prevents inflammatory reactions, allergies. When some medications are started too high, the body reads it as an attack, a foreign invader, like an allergy, and it responds with an inflammatory cascade. With lamotrigine, that can cause severe skin rashes, hepatitis, and bleeding. With Clozapine, that inflammatory reaction affects the heart, which gets inflamed with myocarditis. Other inflammatory reactions are also possible with Clozapine. There's interstitial nephritis in the kidneys, colitis, hepatitis, as well as isolated fever and eosinophilia. And even if you titrate Clozapine slowly, you can still run into trouble, such as if you give it with a strong CYP1A2 inhibitor, which will triple Clozapine's levels. Fortunately, there is only one strong CYP1A2 inhibitor you need to watch for in psychiatry: fluvoxamine Luvox. Some authors recommend monitoring for inflammation while starting Clozapine, such as by checking the C-reactive protein, CRP, and troponin levels, along with the weekly CBC that you normally check with Clozapine, and checking these inflammatory markers for the first 4 to 8 weeks of titration. If those inflammatory markers are rising, the thing to do is to slow the titration down and to stop it completely if you suspect myocarditis. Symptoms of myocarditis include chest pain, racing heart, shortness of breath, and malaise.
Let's pause for a preview of the CME quiz for this episode. Earn CME for each episode through the link in the show notes. 1. What is the primary cause of severe skin reactions during lamotrigine titration? A. Toxic epidermal accumulation. B. Inflammation. C. Coagulation. D. Melanin receptor activation. Lamotrigine is another drug that can cause inflammatory allergic reactions if titrated too quickly. The most famous of these is Stevens-Johnson syndrome, a potentially fatal skin rash that almost got the drug pulled from the market when it was first FDA approved for epilepsy in 1994. Back then, it was started at 100 milligrams, and around 1 in 10 patients had severe rashes on it. The drug company quickly figured out it could lower the rate to around 1 in 3,000 by slowing the titration, which is why we now start lamotrigine at 25 milligrams, raising it to 50 milligrams after 2 weeks, then to 100 milligrams a day another 2 weeks later. The titration is twice as slow if they are taking medications that raise lamotrigine, like valproate, and twice as fast if they are taking carbamazepine, which cuts lamotrigine levels in half.
Older patients and younger patients are more at risk for this lamotrigine rash. Lamotrigine is not actually FDA approved in psychiatry under age 18, but it is approved for childhood epilepsy. And if you're going to use it in children under age 18, off-label in bipolar, I recommend checking the prescribing information. There you'll find weight-based schedules for starting the drug in children with epilepsy that we ought to stick to in psychiatry, because they're a lot slower than what we see with adults.
The slow titration may have warded off most serious rashes, but benign rashes are still common when starting lamotrigine. 1 in 10 patients have them, and you still need to stop the medication at the sign of any rash within the first 2 months, because you can't tell which ones will go on to be severe. That can be heartbreaking, because for many patients with bipolar depression, this is the only drug that helps them, or the only one they can tolerate. Some of them plead to stay on it, but the answer is no. It is just too risky. But in 2010, Dr. Aiken did run the first psychiatric study of re-challenging patients with lamotrigine after a rash. Tell us what you found.
I re-challenged 27 patients with a slow titration, very slow, starting at 5 milligrams a day and raising by 5 milligrams every 2 weeks until we got to 25 milligrams a day. Then we followed the standard titration. So the whole very slow titration takes about 3 months. The success rate was 81%, and there were no cases of serious rash. Other papers have tested this as well, and there are now just over 100 published cases of re-challenge using a similar strategy. Taking all these cases together, the success rate of lamotrigine re-challenge is 85%. And here's an important tip if you're going to do it. Re-challenge is safer if you wait at least 4 weeks before restarting the med. That allows the inflammation to go down, and we found that subsequent rashes were a lot less common if you waited that long. It also gives you time to try another treatment. You wouldn't want to attempt retitration unless other options for bipolar depression like lithium, pramipexole, and antipsychotics have failed.
Re-challenge is also safer if the rash is benign. And here are signs of a severe lamotrigine rash. Peeling of the skin, also called exfoliation or erythroderma. Purple spots, purpura, tenderness or blistering. A rash on the face, lips, genitals, palms or soles of the feet. Lymph swelling. Constitutional symptoms like fever, malaise, muscle aches, sore throat. On labs, signs of severe inflammation include eosinophilia, elevated LFTs, or C-reactive protein. When a patient calls with a lamotrigine rash, I have them stop the medication, and I check for those signs and have them take a picture of the rash. If there is anything concerning, I'll send them to urgent care, where the treatment is usually a prednisone taper. But psychiatric patients don't always follow directions, so if they don't go to urgent care and the rash looks serious, I'll call that taper in myself as prednisone 10 milligrams, start at 60 milligrams a day, and lower by 10 milligrams every 2 days until you get to 0.
That's a good reminder for all of us, and I wouldn't re-challenge if any of those serious signs were present, at least not without dermatology approval.
Now for a research update from Daily Psych. The Daily Psych is one of the rare social media feeds that actually improves mental health, and you can find it by searching for Chris Aiken MD on LinkedIn, Twitter, Facebook, and Blue Sky. Today's paper is also a rarity. The effect of sertraline with or without propranolol on panic attacks in women. A controlled clinical trial by Sahar Ruzender and colleagues from the Journal of Pharmaceutical Healthcare and Sciences. It's one of only a handful of placebo-controlled trials of propranolol in anxiety disorders.
This study randomized 60 women with panic disorder to either sertraline plus propranolol or sertraline plus placebo. The propranolol dose they used was low, just 20 milligrams a day, while other trials in panic have used it up to 240 milligrams a day. They also used instant-release propranolol, but some authors prefer the extended-release forms for anxiety, as patients can experience worse anxiety as the dose wears off. But despite those limitations, propranolol worked. After 4 weeks, patients who took propranolol rated the severity of their panic attacks less. How much less? They rated it at 6.6 compared to nearly double that, 13.1, with placebo. It was a statistically significant difference.
Do you have any tips on starting psych meds? Send them to caiken@thecarlatreport.com. You'll find more dosing secrets in our textbook, Prescribing Psychotropics. the book that Nasir Gami calls not only useful, but engaging and entertaining.